supervisors are present, with Supervisor Parker, Alejo, Phillips, and Adams appearing via video conference, and Chair Supervisor Lopez appearing in person.
As we work through today's agenda, I just want to remind the public, I see we have quite a few folks joining us via Zoom, that if you wish to participate in any item or at the appropriate time for public comment, we ask that you raise your hand using the raise hand function in the Participants tab. Again, you'd go to the bottom of the screen, click on Participants, and at the bottom of the pop-up, there's a raise hand function. That'll let us know you want to be recognized to speak. We'll unmute your microphone and give you that opportunity. If you're participating via landline, in order to raise your hand, you would punch *9. Again, *9 would raise your hand and allow us to see that you would like to speak and recognize you for that time. So we'll use that. I'll try to remind us one more time as we go through this meeting that that's the way we'll take public comment for those participating via Zoom. At this point, I'll ask our CAO, Mr. McKee, to lead us in the pledge. Announcement of the interpreter, please.
Buenos días, mi nombre es María y estoy aquí para los servicios de intérprete en español.
Do we have any additions or corrections to the calendar, Madam Clerk?
There are no additions and corrections.
Thank you. At this point, we're going to take up the consent calendar, which are items 10 through 13. Is there a board member who'd like to pull an item from the consent calendar? All right, hearing none, we'll take it to the public and see if there's anybody in the public who would like to pull an item from the consent calendar. I see one hand raised. That's Bernie Gomez. We're going to unmute you just for a minute, Mr. Gomez, to let us know which item you like pulled. Okay, Mr. Gomez, which item would you like to pull from the calendar?
Oh, can you hear me?
Yes.
Okay, I would like to pull items 10 and 11, please.
Okay, we're going to go ahead and mute you again. I'll call on you when appropriate, and I'll ask one more time if there's anybody via the Zoom who'd like to pull an item from the calendar. Seeing no additional hands, anybody in the room? Seeing nobody rushing the microphone, we'll go ahead and bring it back. 10 and 11, I believe, are linked, so Mr. Gomez, if you'd like to give us your public comment on those, now's the time.
Okay, buenos dias, good morning. I'd like to thank the board and chair for this opportunity. My name is Bernie Gomez. I am the program's leadership assistant at MILPA, Motivating Individual Leadership for Public Advancement. And I have personal experience with centers like the DRC and Salinas that provide reentry services to folks under the direct supervision of probation and parole. I'm here today to ask the board to halt the allocation of funding for GEO services and explore unique alternatives. I ask that we move away from high-cost agencies and corporations that are heavy on corrections, such as this GEO corporation, and reinvest in our local community-based organizations who are tailored to work with our community members in a manner that is culturally relevant and cognizant not only of fixing or helping them, but who are actually interested in changing a system that is trying to address the root causes that lead to incarceration, poverty, and drug and alcohol abuse. The Day Reporting Center provides a universal trauma-informed, a one-size-fits-all approach to a specific population who have been entrenched in trauma-related circumstances. Trauma is not universal. We need healing approaches that address not what happened to an individual, but what is right with an individual. In my experience with these centers, you can't heal in centers where the consequence for missing an appointment or being late can lead to incarceration. Because oftentimes, for me, just transportation or resources to utilize just to get there, where the pressure of finding a ride, taking a bus, finding a babysitter, having to take time off from work means nothing if you don't make it. I asked the board to approach reentry service through a healing lens, explore community-based solutions, and take public health approach that invest in our community our future. There is no public safety without public health. Thank you.
Thank you, Mr. Gomez. Is there anybody else who would like to speak to items 10 or 11 from the public? Seeing nobody in the room, I'm looking at the Zoom and I see Edgar Ibarra. And we'll go ahead and give you 2 minutes, Mr. Ibarra.
Buenos dias. My name is Edgar Ibarra. I'm the Leadership and Program Coordinator at Milpa. And just to speak on this issue is I was a participant of the DRC from August 2018 to February 2019. I successfully completed the program. And throughout my experience navigating this program, the DRC, it was very, very, I would want to say difficult as sometimes managing work, managing school, and managing all the groups that were at the times really required and mandated by the program to finish was very hard. And so I can only imagine what's happening right now throughout this whole COVID experience, specifically for folks who don't have access to electronics such as a computer with a camera or a telephone with internet or anything else, such as a device that can help them engage. So I'm only thinking about that and what are the consequences if they don't actually are able to check in, specifically since we have to stay in the shelter in place orders right now. So I'm thinking about that. And once again, it's very hard in the sense that to actually complete this program, you got to show up every single day. So right now with this shelter in place, I wonder how that's happening. And I just really want to push and really ask this board to really start considering a different approach, specifically focusing on mental health services that are culturally relevant and are healing centered, and also even like reallocating funds for these people who actually are going through this program and might not even have a home to stay in, or might not even have food, or actually don't have nothing going, like don't have any resources, specifically with the loss of jobs in our county and throughout the state. So really thinking about that and thinking about them and their families, and just wondering to see what's the plan and what's this board willing to do to actually support these people in their healing journey, specifically to try to re-enter our community. Thank you.
Thank you, Mr. Ibarra. We're going to go to Cesar Lara next. Mr. Lara, you'll be given 2 minutes to speak on 10 and 11. Thank you.
Good morning, members of the Board of Supervisors. Cesar Lara, and I'm here to ask that the Board of Supervisors don't allocate any funding to GEO services, and we're asking that you invest in culturally appropriate healing centers with mental health services locally based. And we would also request that you support reentry supports for housing. So many people that are formerly incarcerated have challenges in housing. They also have challenges in employment. So we request that the Board of Supervisors invest in employment services, and in particular OJTs, which are on-the-job training programs. These are paid positions. As we know, for many of in our community that are re-entering from their time in incarceration, I think it's really important that we don't continue the cycle and support programs that actually uplift those that have been permanently incarcerated and set them up for success. And the DRC, in the way that they've been funded, does not do that. And so we're requesting that you not vote for this measure on the agenda. Thank you.
Thank you, Mr. Lara. Seeing no additional hands up and nobody coming forward to the mic, I'm going to go ahead and bring it back to this board and see if Mr. Keating, I see you've joined us, and see if you don't have some responses to some questions that were raised last week about the appropriateness of these contracts in the time of COVID, whether or not we'd looked at how the reporting is being done in these interesting times, and how these contracts might be fit to meet the times that we find ourselves in.
Yes, thank you, Chair Lopez. I was able to confirm that the average daily population at the DRC during the pandemic has been 76 participants, and that's compared to 79 participants before the pandemic. Our clients are doing daily check-in calls and to maintain accountability and engagement. And as far as EBP, we have one-on-one telephone calls, group teleconferences, and online-based platforms. just like every entity out there that's providing services, GEO has had to adapt to these times. They continue to be engaged with the clients. And the purpose of this item is to bridge any possible gap in services, because the current contract is set to expire June 30th and until the new RFP can be awarded. So if you have any questions about anything else that's being provided by the DRC, I'd be happy to address that.
Thank you, Mr. Keating. I'll bring it back to this board. Any additional comments or questions on today's consent calendar or these items specifically? If none, I'll entertain a motion to move consent.
Move consent.
Did you move, Supervisor Phillips? It froze up on us a little bit on our end.
Yes, I move consent.
I think we're having an audio issue with you. So can you raise your hand if that was a motion, Supervisor Phillips? All right, we've got a motion. Do I have a second?
I'll second.
Okay, we have a motion and a second. Can we take a roll call vote, please?
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye. Thank you. The consent calendar carries. Let me flip back. At this point, we're going to head into our ceremonial resolutions. We have one, which is a wonderful one presented by Supervisor Parker to us today. So I'm going to see if we have any public comment on today's resolutions. None in room. Any via the Zoom? Seeing no hands going up, I'll entertain a motion.
Move approval. Second.
Motion from Parker, second from Adams. Can we go ahead and get a roll call vote?
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye. Aye.
Supervisor Phillips?
Aye.
Can we go with a raised hand?
Supervisor Parker?
Aye. And by the way, I can hear Supervisor Phillips, so I can attest to the fact that he did say aye, as well as raise his hand.
You can hear him.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye. So it carries, and thank you for the teamwork there. Unfortunately, on our end, for some reason, Supervisor Phillips, we're having an issue hearing your mic, but at certain times it does come through, so we'll see what happens as we move forward here with the agenda. And why don't we go ahead and start with board comments, and we'll go with Supervisor Alejo first.
No, I thought Supervisor Park, were you going to speak on Hazel? Say any words about her?
No, thanks. We are doing the resolution, and then we're going to give it to her. So.
Oh, okay. I just wanted to just acknowledge her as part of my comments because Hazel was my Veteran of the Year during my time in the State Assembly. And not only has she been involved in a lot of community activities, she was also a leader when we were trying to make good changes at Salinas Valley Memorial Hospital. She was one of our community leaders that was outspoken and asking for accountability. And as a representative to the Military and Veterans Affairs Commission, I also just wanted to join Supervisor Parker and really thanking her for a lifetime of service, not only in the armed services, but many years, a lifetime of community service to residents of Monterey County. So I was just really proud to see Supervisor Parker acknowledge her service. A really awesome a person and leader to really thank. But Supervisor Lopez, I just wanted to just take a moment in my comments to just acknowledge that yesterday was Memorial Day. And even though we couldn't have our typical wide range of services all over Monterey County, I did want to take a moment to acknowledge all those that we have lost, all our fallen soldiers in all wars, and to really thank them and their families for that ultimate sacrifice paid for us. And as a son of a Vietnam era veteran, you know, that really means a lot to the military families, but it also it's a reminder to all of us and our younger generations to never forget those who paid the ultimate sacrifice to our nation. So I really want to acknowledge all those since we weren't able to hold our ceremonies yesterday. Thank you.
Thank you, Supervisor Alejo. Supervisor Phillips.
You're going to let me talk, or can you hear me now?
We can hear you now.
Well, and thank you. Supervisor Parker must have broke something loose for me. So no, I also wanted to recognize Hazel Hawkins. I've known her for probably 4 decades and seen all she's done for the community. She's a grand lady. And now Memorial Day, we had our family all came down, and we got our old cars out and exercised social distancing, and just excited about our community coming together and starting to open up and start getting back to some degree of normalcy. And it's a good thing that we're doing this when we're doing it, and as constructively as we're doing it, because you saw so many more cars on the highway and people coming down here. Talked to Ted Ballesteri, and he said Canterbury Row was completely locked up, and there were people all over the streets in Canterbury Row. So it's time that we kind of do it in the right way, in a constructive way. So looking forward to seeing our county get back to somewhat degree of normalcy.
Thank you, Supervisor Phillips. Supervisor Parker.
Thank you, Mr. Chair. I just want to say that, this different way of celebrating Memorial Day, for me, it was quieter, not as many events and commemorations to go to, but I took the opportunity to really just spend some time thinking about the people who have given so much on behalf of our country, and it was nice to have a more contemplative aspect to the weekend. So again, happy Memorial Day, and thanks to all who have served and are serving our country so well in so many ways. Thank you.
Thank you, Supervisor Parker. Supervisor Adams.
Hi, thank you. I'll start with, first of all, my comments on Hazel, who I've known since the 70s and has always been so supportive of whatever political endeavor I was doing. I very much appreciated her presence and her just stalwart support. It was really, really lovely. As far as comments, as I had mentioned, we had a town hall with Dr. Steve Packer last week, and it has been received and viewed by so many people, so many thousands of people, I can't even believe it. And I'm so thankful that people are paying attention and interested in what we are doing as a community as well for COVID-19. This week, my colleague, John Phillips, and I are going to be continuing the work that we've been doing on our ad hoc for hospitality. And Supervisor Parker and I are going to be meeting today with our team to talk about what we can do as far as the personal services element of the ad hoc committee. So the whole engagement from the community has just really been amazing. People want to help with all of this, and I'm very thankful for that. And then finally, I just want to say a shout out to so many people in my own personal life who have given their time and their service, their personal service, whether as a military leader or the spouse of a military leader, whether as parents of children who have served in the military, and so many people who just, like the rest of the communities, as far as coming together and wanting to do something to help. I mean, we're talking about people who have given the ultimate gift of helping in our communities. So thanks to everybody, and it's just a bit of a salute to them all too. Thanks.
Thank you, Supervisor Adams. I wanted to take this opportunity to say, happy Memorial Day, as much as we can put happy in front of that. It is a difficult day. It's a day that we remember those who made that ultimate sacrifice for those who serve our nation. It's a day of memorializing those that perhaps they lost during their time of service. And for us as a nation, it's time to remember those who put themselves between us and harm's way. For me, it was also more subdued holiday weekend in light of COVID-19. I was able to participate in Soledad PD's online commemoration that happened there in the Soledad Cemetery, as well as the Fort Hunter Liggett celebration that happened in the King City Cemetery. But it brought me to a different place. It brought me back to the idea of what else can we do for those who served, who don't perhaps lose their life in a theater of warfare, but instead they lose their lives while here at home battling the demons that they picked up in their time of service. And so I want us to take this day after Memorial Day to just spend a second contemplating, the effects of not just the COVID-19 shelter in place for those who are forced to stay at home, but our veterans who are at home perhaps battling other issues that they picked up while serving our country. We owe them a debt, and it is time for us to make good on that debt as we continue to push forward for mental health needs and advocating for our veterans here in Monterey County. I know that we have a lot of great veterans, including Supervisor Phillips, who's fought to bring additional housing for vets here to Monterey County, and we do right by our vets, but mental health is also one of those places we need to continue to focus on. So as we think about what this weekend means and meant for so many, I hope that that's something that we take time just to think about and find a way to fix as we move forward. Obviously, we've already invested a significant amount of money there, but there's more that we can do, and it's a debt that we owe our veterans. And so that's where my thoughts were this weekend as I was contemplating the ideas of opening up and what that needs to look like for our community. I kept being brought back to that thought. And so I wanted to share it here from the dais and hope that we as a community continue to value and lift up our veterans who maybe didn't make that ultimate sacrifice in a theater of warfare, but when they got home, they continue to fight their fight. We need to support them here at home. So that'll be the extent of my comments, and at this point, I'll turn it over to our CAO for comments and referrals.
Thank you, Mr. Chair. We have one new referral from Supervisor Parker, which is to request that all nominations for board appointments include background information, in the form of a resume or an application that highlights the qualifications, and that information to be attached to the Board of Supervisors agenda for board consideration when they're making an appointment to any of your committees and commissions. And that's the only referral we had this week. And my only comment today is kind of to build off of what you've said just now. I'm a son of a World War II veteran, and he didn't talk a lot about the war, but enough to know that what was really important was the nation coming together and working together to defeat an enemy and to try to build a better place for us here at home. And I think that's the message I would have for Memorial Day as we fight COVID-19.
Thank you, Mr. CAO. At this point, we're going to open it up for general public comments, and I do see Steve Agnini has his hand raised via the Zoom app, so we'll go ahead and recognize our great assessor, Mr. Steve Agnini. Okay. That hand has disappeared, so I'll once again call for public comment for items not on today's agenda. To do that again, if you're participating via Zoom, you would go ahead and raise your hand in the Participants tab. If you're on a landline and wish to be recognized, *9 would serve the same function on our end, and we'll be able to recognize you and give you time to speak. Seeing no hands going up, I'll see if there's anybody in chambers. Nobody coming forward. I do have now a hand up from Karina Powers. If we could go ahead and unmute Ms. Powers.
Good morning. My name is Karina Powers. I'm a salon owner here in the Monterey County, and I'm speaking on behalf of many salon owners. I know that you guys are planning on submitting a letter out to the governor in regards to opening up to phase 2, making it a faster transition for the county. And our business trade, we're already practicing. I know that the salon owners are not available and will be presented until the 3rd phase, I believe. And I just wanted to bring up that many salon owners did not get any government funding to help out to cover for their rent or to cover for their storefront rent as well. We're not getting any unemployment or any loans. And for salon owners, we're only seeing one client at a time. So I don't see how there could be opening for other small businesses. when we see a client, we're already practicing very stringent regulations and following safe guidelines. And we were more than willing to be practicing the CDC guidelines. And I'm asking for the board to recognize these businesses also that are in dire need of being able to practice their business. We have every right to be able to make streamline some income, because we're not getting any funding. We're not getting any funding from anywhere. No one is speaking out for the salon owners. Many of us are, when we're practicing clients, we only see one client at a time. And we're, like I said, we're already going through many stringent regulations to proceed with any services that we give to our clientele. And of course, we want to practice safety for ourselves like we always intend to do, and to continue that along with the CDC guidelines. And my question is where are salon owners seen as far as with the Director of Health to open up, and what is anticipation? Many of us are struggling. Many of us are closing their doors indefinitely, because we're at the point where we either consider—
Thank you, Ms. Powers. Your time is up. Thank you so much for your comments. We appreciate you taking the time to share your thoughts and concerns with us. I know that there is an ad hoc dealing with personal services, and that would be a great way to address some of your concerns. And that ad hoc is being pushed by Supervisor Adams and Parker together. And so if you have additional concerns or thoughts on how we can move forward, I'd recommend you reach out to their offices to help voice your industry's needs. But thank you so much for your comments. I want to see, I'll go one more time to the Zoom, see if I have any hand raised. Seeing no hand, Kathy Biala, we were going to read your comment in, but if you'd prefer to make it yourself, we'll go ahead and recognize you now, Ms. Biala.
Good morning, Chair and board members. My name is Kathy Biala, resident of Marina. Different businesses carry very different risks for reopening, and careful risk assessments must be conducted. Restaurant dining in is a much higher risk than reopening dog grooming, for example, and as such should require more detailed operational mandates. Factors to weigh the risk of virus transmission include identifying the potential numbers and types of customer interactions per hours of operation, the frequency and length of close exposure, the type of shared surfaces or supplies, and the capabilities of consistent sanitizing between customers. I have submitted a sample chart of risk assessment in my written comment. When dining in requires an unavoidable breaking of physical distancing in multiple interactions of taking orders and serving multiple customers throughout long hours of operation, and the fact that masks will be removed when customers eat, this poses a serious health risk to employees and other customers. Do not succumb to pressures to reopen restaurants without well thought out, detailed, and enforceable mandates. Even with takeout service only, many restaurants have experienced angry customers who refuse to wear masks. With dining in services, this will become more problematic. What kind of enforcement can cities and the county offer? Resources for mom and pop restaurants are vastly different from better endowed operations, including chain restaurants, to comply with mandates. If small restaurants choose for safety and financial reasons to not reopen and continue to maintain takeout only, this decision should also be supported to avoid undue and unfair customer criticism. We cannot have a healthy economic recovery without a healthy population. Thank you so much for your kind attention.
Thank you, Ms. Biala. We're going to go to, there's a number listed on Zoom that's 18315. So we're going to go ahead and unmute you. If you'd please identify yourself for the record, and then you'll have 2 minutes to share your comment with us.
Hi, thank you for taking my call. My name is Vanessa Madrid. I'm a Monterey County resident. Can you guys hear me okay?
We can.
Okay, wonderful. So my comment is a multitude of things. I agree with Karina Powers and the opening up of salons and other businesses. I read one of your guys' letters that you guys are most concerned about wineries opening up right now. I don't understand how you guys can differentiate what one business is essential and another isn't. We were in Monterey and we saw a car wash open and these people are wearing masks and they're cleaning cars in really hot weather. And how is a car wash deemed essential when a salon or a barber shop or a nail shop or a mom and pop shop, a small, owned business is not? Regarding the mask deal, I don't wear masks anywhere that I go. I'm a very healthy person. I boost my immune system. My comment here for the masks is if you guys really cared about health, you guys would be encouraging the public to boost their immune systems to get out and get oxygen, fresh air, exercise, but you guys are keeping everybody inside, muzzling people, and that is not effective. There are many scientific studies proving that masks are not effective for the COVID virus. Also, businesses need to open. We're a population of 500,000 people, and we've had 8 COVID deaths. Yes, we've had a lot of positives, but people are recovering. The CDC has already said that this is like a flu. Actually, more people die from the flu daily or yearly. So there is no reason to continue staying shut down. I also wanted to point out that other counties with smaller populations in Monterey County and more COVID deaths have opened up, reopened fully, no masks, and they have no problems. So I don't understand why we are still in phase 1 and we're not moving forward. Also, church services should be open. You guys are going against our constitutional right.
Thank you, Ms. Madrid. Your time is up. We appreciate your public comment. So I'm going to go ahead and close public comment now and bring it back to this board as we move forward with our agenda. I would just like to clarify one comment. We are in phase 2, not phase 1. From that,
we are currently in what is called the early stages of phase 2.
Right. Thank you. Okay, so we're going to go to our 10:30 scheduled matter, which is consider adopting a resolution to approve and authorize the chair of the Board of Supervisors to execute a letter in support of the county health officer's attestation for variance through stage 2 of the state's roadmap to pandemic resilience, and authorize and direct county health officer to transmit the attestation and its accompanying documents to the State Department of Public Health, and that's going to be a presentation from Dr. Moreno and Christy Michi. Thank you.
Good morning, everybody. This is Elsa Jimenez. I started to share my screen. I just want to make sure you can see the full slide on your end.
Full slide, no next slide present.
Okay, perfect. Thank you very much. So good morning. I'm Elsa Jimenez, the director of the Monterey County Health Department. And as you indicated, we will have a couple of speakers this morning. I will be joined by Dr. Edward Moreno, our county health officer, as well as Christy Michi, our assistant director of public health, and our County Administrative Officer, Charles McKee. Today before you, we are here to present to you our roadmap to recovery stage 2 for submitting our variance attestation to be able to progress through stage 2. Now, let me see if I can change slides. Okay. I want to just bring us back a little bit to when this all started. In early March, both our governor declared a state emergency and our county administrative officer declared a local emergency. Subsequent to that, many counties proceeded to develop a shelter-in-place order, and our health officer adopted his first shelter-in-place order on March 17th. Following several counties in the Bay Area predominantly with their shelter-in-place order, the state health officer issued her stay-at-home order on March 19th. About midway through April, our governor announced its pandemic roadmap. And you might recall that it was showcased in 4 stages. And then on May 4th is when we really began to see that there could be potential movement into stage 2. Stage 1 was really about safety and preparedness. And you might recall that really everybody, aside from those that were considered an essential worker, or for all of us to be able to go out to receive essential services, we're really encouraged to shelter in place and stay at home so that we could help prevent the spread of COVID-19 in our county. With the unveiling of the roadmap on May 7th, it really gives an opportunity for us to reevaluate sectors in our community and be able to identify which ones of those are considered lower risk, and moving to begin to adapt, make modifications to the way services are rendered so that we can begin to reopen. And so initially the focus was really on only letting essential services and essential workers to be able to leave their home for to the workplace. And now we're moving into more, how do we create lower risk environments across all of our sectors so that we can slowly begin to reopen. And so today before you, we have an opportunity to be able to articulate how we could safely advance through stage 2 while still maintaining control over the spread of COVID-19, helping to keep our case count low, and more importantly, helping to keep the number of residents who need hospitalization or who unfortunately succumb to COVID-19 complications at the lowest possible. In the first variation, which was released on the first part of May, based on disease prevalence and deaths, which were the priority epidemiological indicator in that variance, many of our small rural counties up to the north, including our own neighboring county, San Benito, were able to attest. You know, about 11 days after that, the state reevaluated its data based on the fact that we as a state had built up testing capacity, we had built up contact tracing capacity, and availability of PPE was more prevalent at that time. And hospital numbers continued to remain very strong overall. And so what ended up happening is that they revised indicators that would allow medium-sized and larger-sized counties to be able to attest. And so before you today, we'll be going through the variance attestation number 2 or version 2, and where we are as a county in terms of meeting those indicators, or what other work needs to be done so that we can progress through advanced stage 2. And so now I'm going to hand the slides over to Dr. Moreno, I believe.
All right. Well, thank you, Elsa. Good morning, members of the board. So moving on. So stage 2 variance, second version, has readiness criteria that counties must meet in order for the state to support that county moving forward at a quicker pace through the governor's stage 2 plan. And these are the components, and I'll review each with you now. Next slide, please. All right, so the first indicator and metrics deal with individuals who are admitted to local hospitals. This is the epidemiologic criteria or indicators that Elsa mentioned. So a county wishing to move to, faster through phase 2, stage 2, must show that there's a stable number of hospitalized cases of COVID-19. So basically, a hospital could still have a slow rise in the represented as a percentage increase of COVID-19 cases in the hospital. That's acceptable, but can't have a large, sharp increase. In the last 7 days, we've have a negative 0.2% change in the number of hospitalized patients that we have. So we're pretty stable. So we do meet that criteria. We don't need to meet both criteria, but we do also meet the second criteria, which is less than 20 confirmed hospitalized cases in any single day in the last 14 days. And the most we've had in the last 14 days were 8 patients on a given day that were hospitalized. So we also meet that criteria. Next slide, please. Continuing with the epidemiologic criteria, we also have to meet these criteria, one or the other. And the incidence of cases on average over 14 days must be less than 25 cases per 100,000 residents, which we have met in the past, but currently we don't meet that criteria, and may possibly be due to increased testing capacity in our community and increased number of cases because of that, which is fine. We do want to increase testing. So the or is we could also meet the criteria by having a test positivity rate over the last 7 days less than 8%. So we look at all the tests that are coming in, that are performed, and what the percentage that are positive. And right now we're right around 2.3% of total tests in the county are positive. So we do meet the second or requirement. So we've met this number 2 indicator. Thank you, Elsa. Okay, and then we also have to demonstrate to the state that we can protect our essential workers. And we have made available to employers and work sites state guidance, and also there are some local guidance that we've included in our attestation for example, from public health, from environmental health, and from the Ag Commissioner's office to allow employees the information they need to create working conditions that reduce the spread of COVID-19. So we believe we've met that criteria. This is an and. We also have to meet this criteria of PPE and cleaning, disinfecting supplies. The workplaces, in order to protect their essential workers, have to have adequate access to cleaning supplies and disinfectant. Recently, the supply chains for these resources has been able to provide more supplies, either through workplaces, regular vendors, or through direct purchase through retail. So we believe this criteria indicators has also been met. Elsa? Thanks. All right, moving on to testing capacity. Previously, the state required testing volume, but the state, I believe, realized that we can provide testing capacity, but there is still a challenge in getting people to go and take advantage of that capacity. So we've moved, the state's moved from volume to capacity, and looking at the capacity of testing that we have at our hospitals, and also at the free, no-cost testing locations at Optum, and also the Planned Parenthood Marmont is coming along. But at this time, we do have, we can test up to 1.6 people per 1,000 Monterey County residents on a daily basis, and that just exceeds the state's requirement of 1.5 people being tested. That 1.5 people per 1,000 could be tested if they chose to be tested. This is another and, so we also have to have testing availability for over 75 residents. And the state defined this. They said that 75% of residents who live in urban areas should be able to drive to get tested within 30 minutes. And if our residents are living in rural settings, they shouldn't have to drive more than 60 minutes. So we've met this, and 88% of people living in urban areas can get to a test site within 30 minutes driving time. And 95% of our rural residents can get to a test location within 60 minutes of driving time. So we've met both those criteria. Next slide, please. All right, we also have to have a surveillance plan, which includes a testing strategy. And Christy Mishi, Assistant Director of Public Health, updated and finalized the surveillance plan. And so we definitely do have testing. We have testing surveillance. We have response to test results, all included in the surveillance plan. So we're ready there as well. All right. The other indicators that are required by the state include ability to contain. Just as a reminder, mitigation are the steps we take to try to slow down the spread of disease. And that includes covering our face, washing our hands, social distancing, staying home unless we have a good reason to leave the house. Once we have people who test positive, then we implement one of our containment measures, and that is interviewing and people who are positive, putting them in isolation, and then finding out who they were in close contact with and getting them into quarantine. So the state has recommended that we have at least 15 staff working in this area per 100,000 residents, which gets us to about 65. And we have ramped up from 3 regular staff that work on this on a regular basis up to 44 now. And we have plans to continue to increase the number of people who are trained. And quickly, the state has created with local health officer and local health jurisdiction input, statewide training module that we're going to be trained on. All of us will be trained on it. And they're finalizing a statewide case and contact tracing database for case management, which we will also be utilizing hopefully very soon. And the second requirement here is that in order to contain the virus, sometimes you have to put people who cannot isolate themselves into a setting where they can isolate successfully. And we do have to have at least the ability to temporarily shelter at least 15% of the homeless population. And so working with Emergency Operations Center and others, we were able to identify that under current agreements and contracts, we can definitely meet that. And we could actually get up to approximately 46% of the homeless population as estimated by the homeless surveys. Next slide, please. We also have to have adequate hospital capacity. So our hospitals have successfully reduced bed census over the last few months by delaying certain procedures. And that lowered bed census serves as the baseline for determining surge. So although some of the hospitals are resuming some elective and delayed procedures so people can get the care they need, based on the baseline, we can definitely meet the 35% surge in bed capacity that the state has established. So we've met that one. We must also be able to have a plan to protect our hospital workforce. And so all of the hospitals early on were struggling, as a lot of licensed care facilities were struggling to get adequate numbers of PPE. That was issue was partially addressed by the CDC and the state issuing guidance on how we can judiciously use PPE to preserve our personal protective equipment for our healthcare providers. In addition, the medical health operations area coordinator for the county was able to deliver on some of the requests for PPE, and now some of the vendors have more access to PPE, which is gowns, gloves, N95 masks, respirators, and face shields or goggles. So the supply chains are slowly coming back. Hospitals have been able to increase their supply. So we believe we've also met that criteria. And by the way, the amount of PPE that's available to us is still not where we want it to be, but we have made some progress as a nation. And then finally, we have, I'm sorry, not finally, but another indicator is how we deal with vulnerable populations. So the county participates in regular meetings with our skilled nursing facilities where existing guidance for skilled nursing facilities is discussed and best practices are shared. So now the skilled nursing, and in addition to that, skilled nursing facilities also have been required by the state to develop plans to conduct surveillance on residents and staff to detect cases of COVID-19 as early as possible in our skilled nursing facilities so we can continue to contain the virus in those settings. And so we've met we're meeting those criteria. And we are currently working on the second criteria, which is that each skilled nursing facility has a 14-day supply of personal protective equipment. And so we, in the last few weeks, the number of percentage of skilled nursing facilities that have 14-day supply has gone from 28% of our skilled nursing facilities to around 75% of our skilled nursing facilities. And we have plans, we'll continue to work with skilled nursing facility on plans to increase so that all of our skilled nursing facilities have at least a 14-day supply, which we believe should be able to get them through an outbreak should one occur in the skilled nursing facility. Next slide, please. So we also have to, so those are the indicators. We do have to, besides the indicators, we have to share with the state what sectors we want to open up in stage 2 and over what timeline. So that's on the next page, Elsa. So the 4 stages of the governor's plan appear in the lower half of this slide, and the timeline of events, both by the governor and the local health officer, appear in the top of the slide. So we can see that in stage 1 on the far left, that allowed essential services to continue. So that was healthcare, ag, for example. And that was those stage 1 or essential services were aligned with the local health officer's shelter-in-place order. Then in stage 2 of the governor's plan, which we are currently in as a state, has allowed for lower risk activities to occur. And many of those are allowed under the current shelter-in-place order. Some of them are still not allowed, but many of them already are. And you can see a little further to the right there, some of the additional activities under stage 2 that the governor has stated can be allowed in a county if the county meets the attestation requirement for variance. And those are the additional services that would be allowed in Monterey County should the board approve the submittal attestation and the state post the attestation. So you can see there, this has been, I believe this has just been updated to include dine-in restaurants and schools with modifications and in-person religious services, which are the governor's just, some of those the governor's just announced are now allowed with expansion to the next stage this week, and also with attestation. So that's the large group that we would be permitting with limitations, as long as the agencies, organizations, and businesses follow the state's extensive recommendations on how to protect both guests and employees. So that's where we want to be by this week. And then stage 3 and stage 4 includes higher risk workplaces and settings, which will should come later. Okay, next slide, please. And then this is really very important, supervisors. The state and counties recognize that as we release restrictions in our counties, people will have more reasons to leave where they live to go and either resume work with limitations and restrictions and requirements, or engage in activities as well. So it's really important that we understand that all this could increase, or anticipate that this will increase the chances for residents exposing people outside of their household, outside that don't live with them. So if we can go on to the next slide. We have, we see here are examples of metrics that we will follow in stage 2. I'm just providing the 4 categories and one example from each category. We actually have 10 metrics that we're going to be following, that we're telling the state we're going to follow, but we're actually, outside of that, we have 20 total metrics, supervisors, that we're going to be following. So slowing the spread of disease still depends on our ability to isolate people with COVID-19 and quarantine contacts. And if we could not isolate at least 90% and quarantine at least 90% of close contacts, then we might have some reason to be concerned there. The others areas, we have the ability to protect those at high risk for COVID-19, particularly people who are over the age of 65 and had chronic medical conditions. So if we start seeing increase in deaths, and right now we're at 2 over the last 14 days, but if we get past 5, then we might have reason to be concerned that more people who are at risk for complications are getting exposed as a result of release of these restrictions. We also have to have capacity in our hospitals and healthcare systems to surge to a greater number of patients arriving and needing care. So right now we have about 71% of our beds, of our baseline beds, are available over the last 14 days. But if we drop to, that drops by about to about 54%, then we might have reason to be concerned that the virus is spreading more quickly than we had hoped. And then the final example I'll share is our ability to do epidemiology and general surveillance. I've been mentioning frequently the doubling rate. For a while now, it's been at 14 days. So just as an example, it's taken about 14 days to get from 150 cases to 300 cases. But just recently, we've gotten to 29 days doubling, which is better. It takes much longer for the total to increase. We're going to go ahead and tell the state that if we get below 8 days, meaning it takes less than a week for the number of total cases in Monterey County to double, then we will definitely have some concern there. Let's see. I think we're getting close to the end here, supervisors. The state also asked that we submit a COVID-19 containment plan, and I'll just give you a brief description of what we have to include in this plan. We have to be able to increase testing capacity from 1.5 residents per 1,000 to every day to 2 residents per 1,000 per day. We have to have increasing contact tracing to satisfactorily reach over 90% of cases, and we do that now. We have to be able to protect residents that live in congregate living settings, such as jails, skilled nursing facilities, and employee housing. We have to be able to show that we have a plan to protect vulnerable individuals, such as those living with homelessness, who are older or have chronic medical conditions, by offering temporary shelter for isolation or to protect them from COVID-19. We have to be able to support local hospitals with PPE as they implement their surge plans. We have to protect essential workers, as I mentioned earlier, and making sure that the work sites understand what they need to put in place to protect the workers. We also have to recognize that here in Monterey County, that ag workers represent a special workforce, and we'll continue, what our plan is to continue to work with advocacy groups, hospitals and clinics and others to protect that valuable workforce. We will continue with community engagement. We're doing that now and continue to play an important role in slowing the disease as we release restrictions. And finally, we'll need to coordinate with surrounding counties. We do coordinate primarily with Santa Cruz County, but also with San Bernardino County. We have employees and residents, excuse me, that live and work across county borders. And so having as much consistency makes it easier for not only the people who live and work across borders, but those that are responsible for enforcing these requirements. So next slide, please. Charles, do you want me to keep going? I'll keep going. About 2 more slides, Charles. And as a condition of considering the attestation, the state requires that the Board of Supervisors provide us a letter of support. County hospitals all have to provide a letter of support. We have those letters from the hospitals. And we went ahead and asked, Charles McKee asked that the cities provide letters of support. So we have most of those support letters. Next slide, Elsa. Thanks. A couple of slides here to discuss briefly the health officer orders. The health shelter-in-place order currently is still in effect. There was a supplement that allowed for additional activities that the governor had released. Curbside retail, I think, was one of them, but that's still in place. But as a result of this attestation, there'll be a need for another order from the local health officer. The laboratory reporting requirement is still in effect. The short-term housing is still will remain in effect. And that is still consistent with the governor's directive that no vacationing, there'd be no temporary lodging for people who wish to vacation. And then the face covering requirement will still remain in effect. Okay, next slide, please. All right, so the new shelter-in-place order will recognize that all early stage 2 activities that the governor has allowed statewide will be allowed. So that's all car washes, all types of car washes, pet grooming, dog walking services, outdoor museums and open galleries, residential and commercial cleaning and janitorial services. Destination retail replaces the curbside and delivery only. So that's new. And in-person religious services with some restrictions is also newly added to stage 2. If the attestation is approved, then dine-in restaurants with significant restrictions would be also permitted, and schools with modifications as well. Next slide. And I think this is where I hand it over to Mr. McKee. Thank you, board members.
Thank you, Dr. Moreno. Very thorough as always, and much appreciated. Excuse me. As the board and everyone can see up on the slide there, the request today and the action today is to consider authorizing and approving the chair of the Board of Supervisors to send a letter to support the county health officer's attestation for a variance through stage 2. And I think that's the main issue here for the Board of Supervisors, as well as authorizing the county health officer to transmit the attestation and its accompanying documents to the State Department of Public Health. Next slide. And so once the county takes those, if the county takes those actions, there would be a submittal of the Monterey County attestation form and the containment plan, as Dr. Moreno laid out. There would be the issuance of a new shelter-in-place order, as articulated by the health officer, which would be to essentially follow the roadmap as laid out by the state and following the state guidelines and protocols. And then there would be education and inspection of businesses allowed to reopen. And with that last piece, I think I would like to just add in there that we've had low numbers here in Monterey County. And those low numbers are not an accident, as the health professionals would say. It's because of the compliance that we've had and really great acceptance of what is needed to defeat the enemy of COVID-19, that virus. We don't want to have a backslide. We don't want to go backwards and have to have the health department say that we're we're crossing into some metrics where a containment plan has to be imposed and then potentially some reissuance of restrictions. I think that would be devastating to our community. I think everyone would agree that's devastating. So I think it's most important, I think everyone would agree it's most important that as we open up, that we're continually trying to balance the protection of public health from the virus itself versus the public health that is gained from having a vibrant economy and having people go back to work and return to some normalcy in their lives. But that would only be maintained by not being too relaxed and not being complacent, but that we're vigilant in protecting ourselves and even more importantly, in some respects, protecting others, because the key to stopping the spread is actually helping to protect others from you potentially spreading it to them. And as the health experts say, you may be contagious without even knowing it. And I just want to reiterate the messages that we've been trying to say over and over, which is to use the best practices that are out there, follow the protocols that are set forth by the state. If you are one that's opening a business under these new protocols, just make sure that you're adhering to that. I think you will gain a lot of support from your customers and from those who want to frequent your business. And we will be able to continue reopening Monterey County and kind of return to the vibrancy that we know Monterey County can have. So with that, I will turn it over to the chair to see if there are any questions or comments. Thank Dr. Moreno for all the efforts he's made in making us safe here. I know it's can be somewhat restrictive and constrictive, and I know he's doing it to try to do what's in the best interest of the health of the county. Elsa Jimenez, the health director, leading that effort, and Christy Mishi with her daily reports of our new cases. The public health lab has been tremendous. Their turnaround time on testing has been far exceeded any of the private labs, but we appreciate the partnership with the private labs, and the work that our public health lab has done is exemplary. So I want to keep the message of staying strong and keeping our community safe.
Thank you, Mr. McKee. I'll take hands in the order that I saw them, which was Supervisor Alejo first.
Yeah, thank you, Mr. Chair. I also want to thank our staff for the presentation and working on this and trying to get this before us over the Memorial Day weekend. I had two questions though, for Elsa or Dr. Moreno or Christy. The first is the obvious one that everybody's asking on the two areas of deficiency when it comes to the number of contact tracers needing the 65 when we got 44, and then for the skilled nursing facilities where we're not there yet of having the 14-day supply for all skilled nursing facilities in Monterey County. So the question is, how does that delay an approval by the state? I know we said we have a plan for both, but how long will it take, and will not having met that criteria, will it delay state approval to move into stage 2.5?
Elsa, do you want to start?
Sure. Sorry. Thank you for the question, Supervisor Alejo. From our understanding and our review of other plans that have been approved and posted by CDPH on their website, and our conversation with staff at CDPH, is that for those indicators where you have to meet a specific measure, that they're holding us accountable to them. But if you have a plan in place to get you there over the next few days or coming weeks, then as long as the plan is solid and that we can articulate and represent how we're going to meet the target of 65, for example, as Dr. Moreno indicated, we do have a plan in place and have other staff within the health department that are ready to go and to be trained and to be deployed in contact tracing. But fortunately, with our 44 that we have in place right now, we've been able to keep up with, the numerous contacts that we have, over 1,500. Christy can probably give you the exact number. So we do have a plan in place, and we remain confident that the state will look at our plan and trust that we could fulfill and implement those elements that are missing.
That's good to know. The second question goes to what the governor announced yesterday, the expanded retail and in-person religious services and ceremonies. And so I know I got this question from the press and members of the public. They wanted to know, just get clarity today from our county public health team. So is the in-person retail available now for them to open as long as they follow that state guidance? And also on religious services, I know some of our faith leaders are looking to restart those services perhaps this weekend. And so does any action need to be taken by our public health officer, or can they start planning for those in-person services as long as they meet and follow that state criteria that was released yesterday as well, along with the retail guidance?
Sure. I see council has his hand up and would like to address that as well, so I'm going to kick it over to Mr. Gerard before we hear
Honorable Chair, members of the board. Supervisor, on May 8th, the health officer issued a supplemental order that aligned his shelter-in-place order with the statewide orders for early stage 2. What the governor did was take retail and religious services and put them into statewide stage 2. So in my opinion, there's no further action the health officer needs to take. They are automatically approved pursuant to his May 8th order. What the new order would do, if the attestation is posted, is move us further along into other activities and businesses that are allowed.
Thank you. And I don't know, Dr. Moreno wanted to add anything more to that.
No, I agree. As far as the supervisor, as far as the skilled nursing facilities, we've skilled nursing facilities across the state have had the same struggles in getting PPE. What's happened though is our county is similar to other counties in which we've made progress, and I feel I have a certain, I think, reasonable degree of confidence that the state will recognize that there's some things that are out of our control, so like supply chains. But if we're going to continue to move forward and recognize the economic and emotional and social benefits of releasing restrictions, we have to move forward. And some things we may not have met, like the percentage, like not having 100% of skilled nursing facilities with PPE, but we are getting there. We've made tremendous progress. And we also have demonstrated that public health and local hospitals providers have actually worked together with skilled nursing facilities to get some of them through some difficult times with COVID patients in their facilities. So I don't believe that that's going to be, they'll have a question, but I don't believe that'll be an issue. And that won't be, I don't believe that'll be a reason why they would not post our attestation.
Thank you. And I do want to thank County Council for making that clarification about the retail and in-person religious services and ceremonies. Because then our community leaders could then properly plan for that from here forward. Thank you.
Thank you. We're going to go to Supervisor Phillips next.
Yeah, I too want to thank the health department, Dr. Moreno and Elsa, for all their work. And like we said, working over even over the Memorial holiday. But and I know we did I think a commendable job of approaching this deliberately and cautiously. And in a way, in a timely way now that we don't see what we've seen in some other places of civil disobedience and just disregard for it. But it's important that as we open up like this, that we get the cooperation of the people in the county, and they still wear their face masks. And we obviously, as we talked about in closed session, we have to do an educational process so that people know that they still have protections that they have to do. But I know the industry has stepped up. Supervisor Adams and I have been working especially with the restaurant industry. They've been out there trying to get a heads up and educating their people. And they're even offered to pledge PPE for skilled nursing homes if needed. So I think the industry is really doing what they can to support what we're going to be doing. So I thank you again for all your hard work.
Thank you, Supervisor Phillips. I'm going to quickly go to Les Gerard, our county counsel, who would like to clarify a prior comment.
Thank you, Chair. I just want to supplement my prior comment about the retail and religious services. The state has issued specific guidance on how those activities can be undertaken. So retail and religious services must follow the state guidance with respect to opening and operating. Thank you.
All right, we're going to go over to Supervisor Parker.
Thank you, Mr. Chair. I do have a few questions. Thank you so much for this presentation and all the work that went into getting us to this stage. Seeing that we're workers are, people are going to start going back to their work sites to a certain degree, and that schools are able to open with some restrictions. Where are we with our small, stable group guidance? I can just see that families and people are going to need more resources for both childcare, how to be safe as they're starting to expand their circles. Where are we with that guidance?
Well, I can start a response to your question, Supervisor Parker. So I have followed up with this with the health officers, primarily in the Bay Area, but also across the state. And there is interest. There is actually some draft language that we're working on. But when we look at that and compare it to the governor's order, we, at this point, I think most of us understand that we would be, if we did something like that, we'd actually be less restrictive than the governor, which we can't be. So we really right now struggling to figure out where that fits into the governor's directives. So that was probably a week ago, last time I had a conversation with health officers. So maybe Elsa has some new information.
No, unfortunately, as Dr. Marnero articulated, it is a concept that is less restrictive than the current governor and health officer from the state order. But know that we are continuing to have these discussions as part of our statewide health officers and health directors convenings with the state in terms of that being something that is being expressed by the community as kind of a next step to develop some guidelines so that smaller groups could gather. It did come up as part of the conversation for reopening faith-based organizations in terms of an opportunity for looking at small gatherings such as being able to resume Bible studies or other types of small convenings within faith-based organizations. And the state is well aware that that is something that the community is expressing as kind of a next step as part of the reopening of California.
Okay, thank you. I'm just worried that people are going to feel the need and they're not going to have good guidance about how to stay safe. So a couple of questions. I guess I have a kind of a broader question, and I don't know if you, Ms. Jimenez, or any of the folks who've been working on this attestation can answer this. But as we are bringing people back to the workplace and they're going to be interacting with the public, we are increasing the risk of transmission. Do we know that there are opportunities in place if a person's employer does not offer paid sick leave or health care benefits or childcare, that there are state or federal resources that do provide those things so that if a worker is sick, they can stay home and not suffer an economic hardship. Do we know if those elements are in place through other programs?
So I don't know if I know the complete answer to your question. I do know that there, as was expressed earlier by one of the members of the public, that the CARES Act funding was not necessarily open to everybody in our community with respect to being able to acquire loans or apply for unemployment benefits, as an example. We do know that one of the strong guidelines and one of the strong criteria in the guidelines across all sectors is that employers have benefit programs in place that could provide for sick leave in case that individual were to be out of work due to COVID-19 related exposure or potential incidents. Now, whether or not all of our employers are following that guideline to the T is yet to be determined. Subsequent to the CARES Act and these guidelines, you know, there is a large segment of our population, particularly in Monterey County, that would still be ineligible for any type of financial support. And so there are dollars that are allocated to be able to be provided to individuals who are in California without proper documentation that would give them a little bit of financial support if they are impacted negatively by COVID-19 and unable to be employed. And the Community Action Board in the city of Watsonville is the organization that is kind of serving as the fiscal agent for those dollars. If I understand correctly, I understand it's like a first come, first serve, and I think there is some advocacy from the Central Coast region in terms of trying to see if there's a more equitable manner of making those dollars allocated, particularly for our county, which has been documented in the past to have the higher per capita individuals that are here undocumented. And I believe that provides a subsidy of up to $500 for an individual or $1,000 for a family member. And I know that it's obviously a benefit that was greatly needed with the fact that on the first day it opened up, the phone system went down. So I think if there, you know, could be more education and advocacy for continuing to assure that there are opportunities for financial support for individuals, either who unfortunately are still not able to return to work, or who, for those individuals who do end up going back to work, but then are not able to continue to provide their service because of the fact that they become a close contact or develop a positive for COVID-19, that they still be able to receive income. And I don't know if that answered your question, but I shared with you what I understand.
Yeah, thank you. I appreciate that. Well, I just think it's something that we need to keep our eyes on. And if we as a county need to advocate for the continuation of some of these supports, I think it's really critical, because we're putting, again, it's the more vulnerable people who have fewer choices and often have fewer resources and don't necessarily have access to, you know, paid sick leave or healthcare benefits. They're the ones we're asking to go back to work in our in these segments that we're opening up. So I want to be sure that we're really trying to think about how to keep a kind of basic set of services available to them so that they can stay safe and take care of themselves and their families, and not be a risk to other members of the community or their families. So then a couple questions about your presentation. One is, you mentioned that there were 20 metrics that you're tracking. In the attestation form, I only saw, I think, 11. Where are those going to be listed, and how will the community be able to track how we're doing on those? Are they going to be online? How do we know what those are?
Hi, this is Dr. Moreno, supervisor. So we have 10 metrics that are in the attestation, and but the surveillance plan that we're attaching to it has the additional 10. So it's not something that we're going to be putting up on the probably not put those up on the website or make it publicly available, because we have to see how these metrics play out. We're starting with a large number of metrics to determine over time which are the most reliable metrics. And if some of these metrics aren't reliable, we may have them drop down as less of a priority and focus on the metrics that prove to be more reliable.
Okay, so you're not going to have them be available online, but maybe as we get the weekly reports, updates on COVID-19, maybe those can be presented. We can get an idea of how we're doing.
We'd be very happy to share with you progress on following the metrics over time, and let you know which are the most reliable and then which are less reliable, and then some interpretation of what it means.
Great. And then once we figured out which ones we're going to use, then maybe they can be posted so that people can keep track of them. Then just a question about testing. Right now, if someone went to one of our hospitals to get tested, they would have to pay for an emergency room visit. Is there any talk about having the hospitals provide testing at no charge?
Well, so this is, I don't know if Dr. Gray is on. I don't think he is. There are ways for, I'm sorry, to answer your questions, I'm not sure to what extent they're discussing it, but what I can share with you is that the way Optum is providing care without a health professional doing an evaluation and doing additional testing and making a diagnosis is that they have a standing order from a physician. And then the staff at Optum Care follow the standing order. And the order is to basically test people, screen people who come in for symptoms, and then test them and submit the collect the specimens submitted to Quest. And that's how people can show up, get tested, and not have to have a medical evaluation or additional testing if they have symptoms. So that's one thing I think that the hospitals could consider, but I don't know whether or not they've had extensive discussions on that.
Thank you. I would hope that that is something we could ask them to do, because one of the reasons the Planned Parenthood MPC site was so overrun is that there are no other testing sites on the peninsula, and the hospital option just, it has too many barriers for and they won't test just anyone. You have to have a bunch of symptoms and they have to check you, and it's just challenging. So as time goes on, if they could be a little bit more accessible and have the tests be done at no cost, I think that would help us a good deal. Thank you.
Okay, Supervisor Adams.
Thank you. I actually don't have any questions at this point because I have been so deeply involved in this in every single aspect of the work that we've been doing, but I sure have a lot of thank yous. And I especially just want to thank Elsa Jimenez, Ed Moreno, Christy Mishi, just working with integrity and diligence and flexibility and unbelievable patience with all of the questions and all of the pushing that I've been doing. And also to our public health lab that just a few years ago was on the chopping block. If we had done that, I can't even imagine where we would be today. But there's so many other employees in the county that we don't see who are just really working 12-hour days to deal with the impact of COVID-19 on the entire county. People like the HR department and the budget department and the treasurer's office. There are so many people who have been just working so hard on this. I know the comment that is being made throughout the country and probably throughout the world is we're all in it together. And this, I see it that way because now specifically, when we're getting so many more of the businesses open, then we get the workers back. Then the residents and the visitors can return. And then we have resources that are generated that funds the county, that funds the services to the residents. I just see it as a full circle. And without each single solitary person that I've named, and even all of us, my own team has just been working so hard, it wouldn't be happening. So we are all in it together. And I think only by staying together are we going to be able to continue to see the good success and that curve flatten and life getting to a new dimension that I think we'll all struggle with at first, but we'll be able to move forward. So just with that, thanks to everybody. It's really been rough, but you guys have just been exemplary. Thank you.
Thank you, Supervisor Adams. I don't have any questions. I just have a lot of thank yous as well. And I'll save those for after we hear from the public on this item. So I'll ask members of the public who wish to speak to do me a favor. Go into the Zoom app at the bottom of the Participants tab. There is a raise hand function. If you'd like to speak, please go ahead and use the raise hand function to be recognized. That'll help me determine how much time to allot. And then first, I'll open it up for folks in the chambers. Is there anybody in chambers who'd like to make a public comment on this item? Seeing nobody coming forward, we'll go to the Zoom and we'll go ahead and make it a 1-minute public comment. We'll start with Mr. Gorman, Jeff Gorman.
Did I unmute successfully?
You did.
I think I did. Oh, good. Well, thank you, Mr. Chair, and thank you to all the supervisors and to Health Officer Dr. Moreno. Thank you for illustrating this very complex job that is necessary to go through the state's requirements, and I think it's good work and necessary work, so thank you. Looking forward, we face a tough winter, and I hope our economy and our health community are well prepared for a tough flu and cold season this next fall and winter. And I'm concerned about the civil disobedience. I respect the right to demonstrate and freedom of assembly and all of that. I'm very concerned, though, that we continue these kind of education efforts so that we're well positioned going forward. And finally, on the civil disobedience side, I'm very curious about the statistics. If we could find out, I noticed a large chunk of our problem with the disease is in the farming and agricultural community. And so I'm interested to know if there is a problem with farm workers that are migrating, and in particular, those that might be not in the country legally, that might be on a different form of civil disobedience. So I hope to hear about that in future meetings. Thank you very much.
Thank you, Mr. Gorman. We're going to go to Kevin Dayton next. Mr. Dayton, we'll go ahead and allow you to unmute yourself. You'll have 1 minute to share your comments with this board.
Thank you, Mr. Chairman. Kevin Dayton. I'm speaking on behalf of the Monterey County Business Alliance, which is a unincorporated association of various chambers of commerce and other allied groups. Just want to say we've been following this closely, as you're probably aware, and submitted information showing the commitment of the chambers of commerce and other business groups in the county to do our best to make sure that the businesses are educated about what they need to do in this particular moving forward in the resiliency roadmap and seeing how we can help them with that. So I'm looking forward to informing these groups that there was a good vote from the Board of Supervisors today, and remind them that this comes with responsibilities as well as celebrations. So thank you for working on this.
Thank you, Mr. Dayton. Next, we'll go to 18315. If you'll identify yourself, and you'll have a minute to share your comment with this board.
Hi, this is Vanessa Madrid from Monterey County. You know, my biggest concern is so many people on unemployment that are not receiving unemployment. So many people with no income that are lining up in the food lines right now. People are starving and going hungry for, again, 8 deaths out of a population of 500,000 people. The whole mask ordeal, these masks are so dirty. We see them all over the floor. We see these rubber gloves on the floor polluting our earth. Where's people using common sense here? Regarding supporting businesses that want to open up, we do support them. And it's not fair that you guys are not allowing mom and pop shops to open up and do business. If you are afraid, stay home. If you want to come out and support these businesses, go ahead and do so. You know, we live in the United States of America where we should be free. You shouldn't quarantine healthy people. Let the healthy people go out and work. And if you're immune compromised, like my son is immune compromised. So I take personal responsibility for his health. I do extra things to keep him healthy during flu seasons. Just every day we take different vitamins. That's what you should be putting out there for your guys' public instead of quarantine people and having people wear masks.
We appreciate your comments. Thank you, Ms. Madrid. We're going to go to Bobby Richards next. Mr. Richards, if you'll unmute yourself, you'll have a minute to share your comments with this board.
Hello, thank you. I was wondering what's the next step if this gets signed and sent to the state? What's the turnaround time for that?
Is that the end of your public comment, Mr. Richards?
Yes, sir.
Thank you very much. We're going to go to Alan Hoffa next. Mr. Hoffa, if you will go ahead and unmute yourself, you'll have 1 minute to share your comment with this board.
Hi, this is
Mr. Hoffa?
Yeah, I'm trying. I'm not sure how to turn off the playback. Okay, I think I got it. Can you hear me? Hello?
Yes.
Okay, thanks. Sorry. I wanted, number one, to support Supervisor Parker's statement about testing. We need more testing free and publicly available. 2, I wanted to let the county health director know that the face mask recommendation went out is a little bit confusing to people. I would appreciate clarity one way or another because it would make it easier for our police to enforce the rules. And then finally, I really want to encourage you to support the attestation. We need to balance public health, which is extremely important, with economic activity so people can make a living. So you're doing a great job so far with finding that balance. And I think if you work with the cities and the businesses, we can find a way to open most of the businesses in a way that is safe. Thank you.
Thank you, Mr. Hoffa. We'll go ahead and go to Rudy Trevino next. Mr. Trevino, go ahead and unmute yourself. You have 1 minute to share your comments with this board.
Can you hear me?
Yes.
Okay, yes, my name is Rudy, Salinas native. I'd like to or in business we have
Mr. Trevino, it's really hard to hear you. I think you have a bad connection.
Okay.
Okay, we'll come back to you, Mr. Trevino, see if you can work on that. We're going to go to Margarita Lopez next. Margarita, we're going to go ahead and give you the opportunity to unmute yourself and share your comments with this board. Margarita?
Thank you, Supervisor Lopez. I just want to go into when we go into phase 2, and I know it's local jurisdictions obligations, that there's more education and inspection in the sites, especially on the H2A kitchens and the businesses being responsible for providing the PPO equipment, because I know it's not being fully enforced here in our jurisdiction. And some of our workers are having to work without the PPO equipment. So I just want to see that there's more pressure on the local jurisdictions from the county as to abiding by these requirements. Thank you. And thank you for all your hard work, all supervisors.
Thank you, Margarita. We're going to go to Misha next. We have Misha. If you'll unmute yourself, you'll be given 1 minute to share your comment with this board. If you would do us the favor of identifying yourself to start.
Hello, everyone. I'm Carmisha Reeb, the owner of Mission 57 Escape Room in Cannery Row. And I just want to say thank you guys for finally showing in the reopening roadmap when entertainment venues might be able to open. But I just want to plant the seed that I would hope escape rooms would be categorized alongside dine-in restaurants due to our already extensive cleaning protocol, as opposed to maybe theaters and bowling alleys. And I just look forward to working with you guys on that so that hopefully we can open up with the rest of the restaurants and get business going again. Thanks.
Thank you, Misha. We're going to go to Paul Ingram next. Mr. Ingram, we're going to give you the opportunity to unmute yourself and share your comments with this board. Mr. Ingram, you need to unmute yourself. Mr. Ingram? Okay, don't think he's there. We'll go ahead and try Rudy Trevino again. Let's go ahead and give Mr. Trevino the mic again, and let's see if your issues have been ironed out.
Yes, can you hear me?
Yes, much better.
Okay, so yes, my name is Rudy Trevino. I'm a resident currently of Salinas. I just like to ask the board to move forward with this proposition. I think it would be in the best interest of the residents and employees of Salinas. We have a lot of people suffering economically since the start of this pandemic, this Chinese virus. We've had 28 deaths in our county. While it's unfortunate that that has occurred, I think that is a relatively low number. More people are going to suffer from this economically, as we can already see. We have, in regards to the masks mandating, we have businesses in the county that are not abiding by the ADA policies. Not everybody can wear a mask due to their, they might have health issues, and these businesses are not allowing anything of that sort to happen, and they're not following the law by abiding to the ADA policies that are in place for those that are that can't wear these masks. So I think it would be important if we can take that away and let everybody make their own choice. It's like a past resident said, if people are scared, in their best interest, it would be for them to stay home. But I think moving forward, it would be the best interest in the county and for the residents that are not receiving any type of state unemployment, any SBA
Thank you, Mr.
loans.
Trevino. Your time is up. We appreciate your comment. Thank you. We're going to go to Mr. Frank Geisler next. Mr. Geisler, we're going to go ahead and give you the opportunity to unmute yourself and share your comments with this board.
Yes, good morning, supervisors. And Mr. Chair, I want to thank you for the work that you've accomplished and also for the positive decision you're about ready to make. Opening businesses is really important while respecting the health mandated by the state and also protecting the vitality of the small businesses. I'm the CEO of Monterey Peninsula Chamber of Commerce, and we receive daily calls of small business owners that are desperate about reopening and that want to follow all the guidelines, but also want to keep their employees working, their doors open, and their customers coming back. So all of that while supporting the vitality of our region and the health of our community and our residents. So thank you so very much.
Thank you, Mr. Geisler. I'm going to go one more time, see if Mr. Paul Ingram is with us. Mr. Ingram, if you'd raise your hand, we were trying to recognize you earlier, but had an issue that you couldn't be heard. Want to give you one more opportunity if you're still interested. Let's go and unmute Mr. Ingram now. All right, let's try that. Mr. Ingram, you with us? Unfortunately, I think it must be an issue on your end with your microphone, Mr. Ingram. We can't hear you. So we're going to go ahead and move on to Karina Powers. Ms. Powers, you'll be given 1 minute to share your comment with this board.
Thank you to all the supervisors for all your hard work. And also on behalf of small business owners, we are struggling. We are not getting any unemployment, any government handouts, and we need help from a local municipal community to help us out as far as small businesses. Even though despite the opening, we're still in the transition of trying to make the profits of the losses that we already had. And we just need to, I reach out to the Chamber of Commerce to kind of build an alliance for small businesses to help out during this hard time. A lot of us are suffering. And if there's anything that we can do, and reach out to some of you as the supervisors who can help us out in getting the community and transitioning into this difficult phase, we really appreciate that.
Thank you, Ms. Bowers. We appreciate your comment. Seeing no other hand raised and nobody rushing the mic in chambers, we're going to bring it back to this board. And I see Supervisor Alejo has his hand up. Supervisor Alejo.
Yeah, Mr. Chair, thank you. I think many of us are proud to get to this point where we could have this discussion and move Monterey County through this attestation variance. And I did want to acknowledge all our county employees who have been part of all these efforts we've been doing, and certainly acknowledge all the sacrifice by our residents who have asked what we've urged them to do, which is to protect themselves, shelter at home for quite a long time now. So I do want to acknowledge what our residents and our businesses have been through. It hasn't been easy on anybody, but the 8 deaths are significant. These are our residents. Every death matters, and it's a for all of us. And I would post after every time we lost one of our residents to COVID, I posted that we all mourned with those families who lost their loved ones. And but at the same time, even though we're ready to make this step at this moment, we're not out of the woods yet. There is a lot. We have to continue to take this very seriously and practice all our safeguards and best practices to keep people safe and reduce risk, because there is a real lingering threat out there. And we started seeing some of that risk last weekend, when it's not only our own residents, but we are a destination for a lot of people to come and relax and enjoy the beauty that exists in our county. But we did see large crowds and people not wearing masks and not social distancing. That's going to continue to be a concern. And so, as was said earlier, we're all in this together, but if we're not following the best practices as we move forward to reopen additional segments of our economy, we don't want to be in a situation where we would have to reclose down the road because of a large spike in additional cases. Just as an example, Riverside County that removed a lot of their local health and safety orders just in 1 week, from last Monday of last week to yesterday, they had 1,052 additional cases in 1 week. That was a 15% increase in a matter of 7 days. So we're taking this and doing it very thoughtfully. And we've always said trying to do this smart, strategically, but always keeping public health as a priority, because every resident's health does matter to us as elected officials. It matters. I know for our health professionals, it matters. So even though we're ready to move through this attestation period, I just urge all our residents, I urge all our businesses that we need to keep practicing what we've been doing for the last several months, so that we don't have those numbers spike up as we're seeing already happen in other counties. And with that, Mr. Chair, I'd like to make the motion that we approve these items. So I make that motion at this time.
Thank you, Supervisor Alejo. I'm going to be happy to second that. I did hold my comments till after to share with everybody the thanks that I have, which really go out to everybody on the county team who has put aside whatever job they have and focused on helping our community address COVID from the beginning. This is one more step in the right direction, but it's not taken without preparation, without concern, without some reservation. You know, this comes down to personal responsibility for a lot of us, and I do believe that that's something that we have the ability to do. We as a county still have places we can improve on, especially on our communications end, and we're taking steps to get that done as we move forward. I want the community to know that it's not a time to let your guard down. It's a time to step out, but be prepared. Take care of yourself. Wear a face mask, as the order says, or a face covering. And be cautious, because it's not just about us as individuals, it's about us as a community. All of us together are connected, and whether or not we see the need in our community, there are people who need us to be more cautious. And so as we move forward, I just hope that folks will continue to be cautious about their approach and make sure that everything done is done in a way that's going to protect not just yourself, but everybody around you. The COVID-19 is in Monterey County. We took steps before we even had a first case in Monterey County to put ourselves in a position where we could keep our numbers low. And those steps taken by Dr. Moreno and the entire team at the county has helped keep our numbers low relative to numbers of other districts, other counties around the state of California. And so because of that, I think we're well positioned to be able to take these steps today. But again, we must continue to be cautious. We must continue to look out for one another, and we do that best by taking every precaution that we can to protect our community, ourselves, and those around us. I see Council has his hand up, so I'm going to go ahead and go to him.
Thank you very much, Chair. For anybody who has seen the length of my hair, you will understand how happy I am to make an announcement that the governor has just issued guidance that hair salons and barbershops may open with a variance. So,
hallelujah. I needed that too. Thank you so much. I know my barber's probably jumping for joy at this point. So now I'll open it up to other supervisors for additional comments. We do have a motion in a second, but before we vote, I'd love to hear any additional comments from supervisors. I see Supervisor Parker has her hand up.
Thank you, Mr. Chair, and thanks for your comments and Supervisor Alejo's comments. I do think with this good news about barber shops and hair salons opening, along with retail and churches, of course, with the restrictions, to the extent those things are not addressed in the local shelter-in-place order, I think it's going to be super important for us to have links to the state's guidance front and center, very easy for people to find on our website, and get that information out to all of the different partners we have in the communities, because people are going to need and want that information. And if we're not providing it, then we need to make sure that it's easy for people to find the guidance. Also on the small stable group, I do think that maybe we need to write a letter or work with our public health officer and our health department director to find out who we need to be talking to at the state to ask for them to help us come up with the kind of guidance we need to implement small stable group guidelines. And I just do want to say too how much I support this action today. I so appreciate, as I said, all the work that went into getting us to this point. You know, the majority of our residents are concerned about safety. That's one of the reasons we have had such phenomenal compliance with the shelter-in-place order that has been quite restrictive on people's lives. So having this carefully thought through plan, it's a good plan. There are good criteria to monitor how we're doing. It's thoughtful, it's data-driven, it's deliberate. We're remembering the vulnerable. And I want to thank the elected officials from most of the Monterey Peninsula cities who wrote a letter to the editor of the Herald last week, really supporting the county's approach, Dr. Moreno, this thoughtful, careful approach that is keeping people healthy. So I want to thank them. And again, you know, as has been said, we are all in this together. It has its plus side. It also has its challenges. So just again, you know, be safe, be thoughtful, be kind, and really appreciate, again, all the work that's gone into getting us to this really important jumping off place today.
Thank you, Supervisor Parker. Supervisor Phillips.
Yeah, I echo the comments of my colleagues, and it's been a rough time, and I really commend the people from the county that's done so much. I think we were all concerned about the safety, but also you have to be so concerned, and our people were so concerned about the economics, not just the economics, but the people's lives that were impacted, the workers there in those little businesses. And the longer this went on before we could get it open up, the more businesses would not recover from this. And so I think this is a critical stage for putting those people's businesses back together, but also putting their lives back together. So I'm very happy to support this motion.
Supervisor Adams, any additional comments for us?
I think I've said my piece. I'm just grateful, grateful, grateful. Thank you.
Great. Then before, I want to be respectful. I see Mr. Ingram's hand went down and came back up. And so just to make sure that we have as many opportunities for him as possible, I want to give Mr. Ingram one more shot, see if we can't unmute him and get his 1-minute public comment in before we take this vote.
Can you hear me, sir?
We can.
Oh, thanks. I have to allow my phone to access the microphone. Anyway, my comment is, you need to find a way to open pools to children only. I live in Carmel Valley Village, and the community pool is closed, and kids are trying to find their way down to the river, and it's very hot out there. So that's my comment today.
Thank you, Mr. Ingram. We appreciate you being persistent through the technical challenges. And with that, I will turn to our clerk and see if she will do me the favor of taking a roll call vote on this item.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez?
Aye. Thank you so much. The motion carries. We're going to take a 10-minute break, and then we'll come back and we will finish the morning's agenda as we power through. So again, in 10 minutes, which would put us right at, let's call it 12:40. I'll throw a couple extra minutes in. We'll reconvene and finish up the morning's agenda. Thank you. Good afternoon. I'm going to reconvene the Board of Supervisors here for our session. Can we get a quick roll call, Madam Clerk?
Let the record reflect all supervisors are present, with Supervisor Adams, Parker, Phillips, and Alejo appearing via video conference, and Chair Supervisor Lopez appearing in person.
Thank you. We're going to item 8, which is a briefing and update on COVID-19, including impacts, action, proposals, and plans to address that. We have Nick Chulos here with us to give us a lead-in.
Very briefly, Mr. Chairman and board members, the presentation today is going to be about the work of the ad hoc Committee on Agriculture, which the board had appointed or has designated in the recent past. And I believe we have Kim Stemler doing that presentation and
Henry Gonzalez
doing the other part of the presentation. Thank you.
Thank you. Can we go ahead and pull those two over into our live session so we can hear their updates? Maybe while we're doing that, Ms. Jimenez, can you do me a favor? There was a comment made to me by Council Gerard about some embedded links that will be available in our documents for further clarification for the public. I'm wondering if you can give us some insight on those and how soon perhaps that FAQ will be available for the community to understand what the impacts are of the decisions made today. Okay. She must still be on break.
We might have to.
That's what I get for giving people too much time. Okay, we're going to go ahead and continue then with the prior presentation, and that's going to be Henry Gonzalez and Kim Stemler, who we're going to go ahead and pull over from our attendees list to make this presentation to the board about the Ag Ad Hoc Committee's work and what we've accomplished to this point, and where we might be in terms of submittal to Dr. Moreno for consideration.
I moved over Henry.
Okay, so I see Henry and Kim are both with us now. I don't know.
Checklists and making sure that you're able to collaborate with sites.
We got something in the background of you, of your microphone there.
We've digitized a check.
My other Zoom meeting I'm on. Sorry.
So now you and Henry are both unmuted, so I'm not sure if we've got a visual share screen's now available to you for this presentation.
So I'll present, and then Kim will also present more specifically about wineries. But anyway, thank you for the opportunity. And good afternoon, supervisors and Chair Lopez, Mr. McKee, and Mr. Gerard. So I'll be presenting a verbal update with regards to some work from an Ag Ad Hoc Committee consisting of Supervisors Alejo, Chair Lopez, Kim Stemler, Executive Director of the Monterey County Vintners and Growers Association, Norm Groot, Executive Director of the Farm Bureau, Monterey County Cannabis Industry Association Attorney Aaron Johnson, Growers Shippers Association President Chris Valadez, Director of Regulatory Affairs for the California Strawberry Commission, Eric Lorenzen, and myself as Ag Commissioner. This is the same group of leaders that developed the first in the nation advisory telling agricultural employers about the measures to protect their workers from the COVID-19. And I believe that we're also the first business sector to develop our guidance document with regards to phase 2, phase 3, and actually phase 4 of the re-engagement. The Monterey County ag industry is of great importance to us, generating over $8 billion annually in direct and indirect activity. But agriculture is not only important to Monterey County as our #1 economic driver, but also to people around the nation and other countries that get their fruits and vegetables from the salad bowl of the world. Agriculture has not stopped, it never did. We slowed down. As part of the nation's essential infrastructure, Monterey County agriculture did not shut down. It only slowed down due to the sudden loss of the food service sector, again, due to the COVID-19, the closure of schools, restaurants, hotels, and other venues where produce would have been served. As a matter of fact, we conducted a preliminary survey here recently and showed that there are unprecedented losses, fields that have been plowed under, contracts that were reduced or eliminated, planning schedules put on hold. We won't know the full impacts of the COVID-19 on agriculture until sometime later after it has passed. The document that we put together provides guidance protocols to protect the community at large and the employees of Monterey County agriculture industry more specifically, and also its related business operations moving forward to stage 2, stage 3, and stage 4 of the pandemic. The guidelines include information about agriculture, tourism, and childcare for essential workforce, along with protocols for the following subsectors. So again, agriculture and agriculture supporting industries, cannabis, cultivation and dispensaries, the wine industry, vineyards, wineries, and tasting rooms, which Kim will be here to also address. Also the beer industry, breweries and beer tasting rooms, and of course our farmers markets. As part of the Monterey County agriculture, we have not responded to COVID-19 just now. We started some time ago. First, we developed the advisory, followed by partnering with the industry and the county with arranging for COVID-affected farm worker housing. We've developed public service announcements, informational cards. We created and distributed relevant information. And right now we're in the midst of distribution of face coverings or masks. So this document, it's a 31-page document, is to help us get into more fully phase 2, phase 3, and then phase 4 of the re-engagement. With that, I'll leave it at that, but I'll take any questions that there may be. And maybe Kim wants to elaborate on the wineries, the vineyard tasting rooms.
Yes, so thank you so much, supervisors, and thank you, Henry. This has been really an amazing process in watching us come together for the health and safety and welfare of our community. And I so appreciate the county. I so appreciate our sister ag associations and just the work we've done with the county to get us to the place we are. So I want to talk about wine. Wine is an essential industry, as some of you may know. But we have to stay in our vineyards. We have to stay in our wineries. So we have been able to operate with the exception of on-premise tastings. So that is the one thing we can't do. And on-premise tastings are where you go into a tasting room and you have the experience of tasting wine. That is part of the state stage 2 business reopening phases. And our hope is that you will allow us to do that as soon as we get the variance and as soon as the ABC, the Alcohol Beverage Control Department, allows us to reopen. I'm on another Zoom meeting because this is our weekly meeting for our tasting rooms. We have been meeting for 6 weeks, planning the safety protocols for reopening. We have been so conscientious about how we work and caring for our staff who really are our family and caring for our community. So I just, you know, out of every crisis comes these silver linings, and the silver lining has just been the unity the unity that's come out of all of this. So as a county, even though lots of people, and probably a lot of you, are buying quite a bit of wine, you're buying it through only one channel. So we're anticipating about a $250 million loss to our local, this is Monterey County wine community this year. And just in tasting room sales alone, we're expecting a decline of $105 million. So what I'd like to say to you is please have confidence in us. We are being very active in our provisions, and also we're fully ready. We can open this weekend if we get the go ahead. So thank you. And I'm open to responding to any questions as well.
Great. So I'll bring it back to the board, see if we have any questions. Again, what we've done is we've created some protocols that address the balance of agricultural industry sector, the balance of the sector that is not yet open. And one of those key points is tasting rooms. So there's an entire protocol on how we can best address that in terms of how they could potentially open as we move forward. And one of those changes is really moving to sort of a more like a restaurant sort of atmosphere, with somebody actually greeting you at the door and assigning you a seat and going through that process. So this has been kicked around by our working group, and I see Supervisor Alejo has his hand up, so I'm going to go to Supervisor Alejo first.
Thank you, Chris. I first want to really thank all our partners, the different ag associations, and our ag commissioner and Supervisor Lopez. As was already stated from the beginning, actually just days after I think our shelter-in-place order went into effect on Tuesday, March 17th, our committee already had this advisory for the protection of agricultural workers on Friday, March 20th, 3 days afterwards. It was really quick turnaround. And ever since then, there's been good communication, a good working relationship, and a lot of follow-up to try to address the needs of our agricultural industry and the protection of agricultural employees in Monterey County. I think it's a model exemplary effort. Yes, we still have high numbers of impacted agricultural workers, and they're not just farm workers, but every type of employee in the industry. But we've been able to make a lot of changes and follow-ups where we heard that there was some issues going on. That communication and working relationships really helped us elevate. And beyond that, then we saw additional efforts come out of that. For example, the grower shippers partnership with our local hospitals to now do outreach and education for workers at the work sites. That's the first of its kind in the country. Our ag commissioner just released a business card that's going to go out to over 10,000 farm workers that gives them all the key contacts, key information, symptoms to look out for. Another first of its kind effort for our employees. So we've really done a lot. But when it comes to looking at about what does reopening additional sectors of our economy look like in Monterey County, we knew that this work and relationship and communication needed to continue, even looking at additional sectors like the tasting rooms or breweries. And I do appreciate the efforts by Kim Stemler for reaching out to folks, because it's not just thinking and planning together, but it's getting input and buy-in and support from our local industries. And I think that we've done that very well. And I appreciate the ad hoc coming together and having a document that we could put forward as our local guidance, crafted. Yes, sometimes some parts are crafted from state existing guidance, but we have our own local document that's easy, one document that people could turn to and look for as guidance. When we get to those other stages, like in stage 3, where we can open tasting rooms and breweries, we know that those are all important parts of our tourism industry, whether it's in Carmel Valley or the Salinas Valley. These are all important parts of our local economy. And I know things that our local residents and our visitors both enjoy. But again, as we're trying to say that we're planning already, we're not waiting till we get there, but talking now how we could reopen when the right time comes to do it smart, strategic, and putting public health as a priority. So I just really want to commend this work, and that we're the first ad hoc to kind of bring the document forward for the public and for the industry to benefit from.
Thank you, Supervisor. I will just share that our ad hoc is not disbanding. We're going to continue to work together, and we meet once a week, if not more, in order to address these issues. And at this point, this document is ready for submittal to Dr. Moreno for consideration. But again, we did just want to share with the community that a lot of work has gone into this document, and it's now ready for his consideration. And so with that, if there's no additional questions, we're going to go ahead and move on with the agenda. So thank you so much, Kim and Henry. I'm going to see if...
Chris, I don't want to make this mistake. Tasting rooms are in stage 2 later, part of stage 2, not stage 3. So I just want to make that clarification.
Okay, perfect. Supervisor Parker, I did see your hand go up before I moved on.
Thank you. I raised my hand when I heard you say you were going to move on to the next item. I just have a quick thing while we're still on COVID-19, and that is I'm getting a lot of questions about the barbershop opening thing, and I wonder if we could just get clarification. Will hair salons and barbershops in Monterey County be able to open as soon as they comply with the state guidelines, or do we have to wait for our attestation to be posted by the state?
So I promise I'll get you an answer on that, but by next item I meant letter C, so just kind of moving down. But I want to see if we had any public comment on the ag side before we move on. I see no hands going up and nobody in chambers, so now we'll go ahead and go back to Elsa. I know that there were some questions about the embedding of links and documents to more clearly answer through FAQs some of these challenges that we're hearing about, including the new information released today on barbershops. Any clarification you could provide would be greatly appreciated.
Sure. So we do have some local guidance that we've developed, which is included in our attestation, specifically for employer-sponsored housing and such. For all other industry guidance, Monterey County is not going to be developing its own specific guidance, but will be deferring to state-developed guidance. And so in addition to revised FAQs that will be posted as soon as our new shelter-in-place order is released, will be embedded links to the appropriate guidance, whether locally or the state. And in addition, we'll create on our landing page of the health department's COVID-19 pages where we will discuss reopening and again refer to industry guidance and appropriate links. So we'll try to hopefully help the public be able to get their hands on the appropriate guidance for their industry so that they can begin to properly plan so that they could reopen. With respect to barbershops and hair salons, those are included in stage 2, but with attestation. So what that means is that once Dr. Moreno submits the county's attestation to CDPH and it's posted, a new shelter-in-place order will be released to the effect of aligning with the governor's stage 2, all stages, both early and with attestation, that will then permit dine-in restaurants and now barbershops and hair salons to be able to reopen again in accordance with state guidelines. Development of a local plan, making sure that their staff are trained, making sure that they're enforcing the health officer local order on face coverings, access to hand sanitation, the physical distancing, all of those measures that we know are even more critically important now to abide by as there is more movement of individuals throughout our county.
Mr. Chair?
Any follow-up questions, Supervisor Parker?
Yeah. Oh.
Sorry.
I have a follow-up question just on the same lines.
Go ahead, Supervisor Leo.
Thank you, Mr. Chair. On the, because of the breaking news yesterday of the retail, I think there was a question also, and we said the churches and the retail need to follow the guidance, and that guidance does include having a written worksite plan, a plan for employee education, employee screening, disinfecting, what have you. But the question is, do those businesses need to get any approval by environmental health, the public health department before they can reopen, or can they reopen and then make sure they're working on creating all those requirements per the guidance?
So I'm going to defer that to Dr. Moreno to answer. Thank you.
Yeah, that's fine. Thank you, Elsa. So, so we are going to be working with environmental health to have their inspectors go in and do their normal regulatory inspections. And in the course of the regulatory inspections, they're also going to be aware of and bring with them the state guidance and any local guidance on adhering to requirements to reopen. That's a portion of all the businesses, and I think that's why we also were looking towards the cities, if they have any permitting processes, for example, that they would also assist in observing the other businesses and activities that we don't directly regulate to assist those business owners with understanding what the guidance is and how to comply with the guidance, and answering any questions that employees might have if they're concerned that their work site is not meeting requirements.
So again, businesses are wondering, can I open tomorrow, or do I need to wait for environmental health or somebody to come visit? It's just a practical question of can they start reopening today or tomorrow for the government?
So my suggestion is that the businesses don't rush to open. I know there's eagerness to open, but the businesses really need to look at the guidance for their particular sector that the state has issued as terms of reopening those services. Rushing to reopen services without preparing the plans and implementing the plans, and then teaching training the employees on the plan is going to lead to two things. One's going to probably lead to some complacency as people open up, and if they're complacent about it, they're going to delay. The other thing is going to lead to unnecessary exposures, which is going to make expose their employees and their customers, and people will get sick. So there's really encourage people to not rush. As soon as you feel that you understand the plans, you've trained, you have your own plan, you understand the requirements from the state and any requirements that environmental health is requiring locally, you have your plan in place and you've trained your staff on those, then that would be the time to go ahead and open. Our environmental health specialists will be adding this to their normal rounds. What they may do is what they did with twice already during this shelter-in-place orders. They made special rounds of the restaurants and other regulated businesses out of the normal rounds to do, and they did a brief inspection, but they also did outreach and education to make sure that the business owners understood. So again, really encourage people not to rush into this. Business owners really need to understand what the requirements are, develop the plan, train your residents, and then be ready to, because the cities or the environmental health or other regulatory agencies will be coming in to do ongoing outreach education and make sure people are complying.
Thank you.
Any other questions, comments from the board? All right. With that, we'll go ahead and close item 8 then and head into item 9, which is consider the adoption of a resolution in connection with issuance of bonds by FORA, the Forward Reuse Authority. And that's going to be a presentation from Melanie Beretti and Wendy Strimley.
Good morning, Chair, Supervisors. Melanie Beretti with the Resource Management Agency. I'm going to let Wendy Strimley speak mostly because the action before you has a little bit of legal nuance, but just as an overview, while the County of Monterey and its tax increment from the East Garrison development had been considered previously as a part of the revenue to repay the bonds, and therefore the county was being considered to receive bond revenue. Due to challenges upon getting into underwriting, that the county is unable to provide the level of assurance given just the nature of the development and disposition agreement with the East Garrison development. The county revenue is no longer going to be part of the repayment of the bonds, and therefore the county is no longer going to be a participant in the bond issuance. So the item before you today are more administrative in nature to support the Forward Reuse Authority's issuance of the bond, which the county will not be party. And I'll pass it over to Wendy Strimley.
Okay, hello, good afternoon, and I'm trying to share my PowerPoint. Is it showing up? That's a question.
It is.
Yes.
It's not in presentation mode, but we do see your slides.
It's not in presentation mode. I'm trying to figure out how to put it in. Well, let me just do it.
Go ahead and continue.
I'll just go ahead. Yes, your actions today, I'm going to go back to slide 2. The proposed board actions today are to adopt a resolution to approve 2 documents. One of them is an irrevocable direction to transfer funds. And you would also be authorizing the auditor, controller, and treasurer tax collector to execute those irrevocable direction. And then also the second action is to approve a certificate of the county and authorize the chair of the board to sign the certificate. As Melanie stated, the county's tax increment is not participating in the bonds as proposed, nor is county proposed to receive bond proceeds. However, these actions today are requested by FORA and the bond underwriter. So just to explain what they are, the irrevocable direction has to do with the role of the auditor. The auditor is the officer who distributes tax increment. And so the irrevocable direction directs the auditor to remit directly to the bond trustee tax increment from basically redevelopment areas in Seaside and in Marina. And then also, if there's any leftover tax increment, it comes back to the auditor as, quote, surplus. And then there's a statutory formula for distribution of the surplus. And so the irrevocable direction authorizes those irrevocable directions and authorizes the auditor controller to remit the tax increment. And also, as part of those irrevocable directions, the county is recognizing that the city of Marina will be the administrator as successor to FORA after FORA dissolves. The certificate of the county is basically just a statement that the board county has duly authorized the irrevocable direction, that the direction is consistent with Health and Safety Code section 33492.71 as confirmed in FORA's validation action, and that the county will not take any action to challenge the right of the bond trustee to receive the tax increment as contemplated by the bond indenture. So again, the recommendation is that you adopt the resolution to approve the irrevocable direction, authorize auditor, controller, treasurer, tax collector to execute it, and approve the certificate of the county and authorize the chair of the board or authorized officer to execute. And that concludes our presentation.
We'll go to questions or comments from board members first. See no hands going up. I'll take it to public comment. See if anybody in the room. Nobody rushing the microphone. Anybody via the Zoom wish to comment on this item at this point? Okay, no hands going up. I'll bring it back to the board.
This is Jane. I'll move approval.
I'll second.
Got a motion and a second. Can we go ahead and have a roll call vote, Madam Clerk?
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye. At this point, I'm going to turn it over to County Counsel, since the motion is carried, to let us know if there's anything that he needs to read out of closed session.
Thank you, Chair, members of the board. 2 items to be read out today in closed session by unanimous vote. The board authorized the county to join amicus curiae briefs in 2 cases, Oakley et al. Versus DeVos et al., U.S. District Court for the Northern District of California, case number 3:20-CV-03215, and the case HIAS Inc. et al. Versus Trump et al., U.S. Court of Appeals for the Fourth Circuit, case number 20-1160. That concludes my report.
And with that, we are adjourned. Thank you, everybody.
Thank you.
Bye.